essentially the POTS and dysautonomia condition, we see that in a variety of conditions, whether it's the primary or it's a secondary or tertiary sort of ailment. We see it heavily with concussion. Pretty much, I think 100% of the cases of concussion I've seen in my clinic at least also have a degree of POTS. There's varying degrees based on whatever definition you want to diagnose the condition with, but it essentially has a constellation of symptoms associated with it, and really it has to do with changes in blood pressure and blood vessel constriction going up to different regions of the brain. Everybody's POTS is a little bit different, but as far as symptomatology, but for the most part, people have always talked about they have vertigo, they'll get dizziness, lightheadedness, even nausea. Some people get extreme fatigue, weakness, like physically they just feel like they can't move their limbs, and some people even get nauseous to the point they vomit. So what we try to do is influence the mechanism of that. Essentially what it is the receptors in the brain aren't getting enough signal that they're getting enough oxygen. And there's a variety of reasons you're not going to get enough oxygen up to the brain. Really quick, wouldn't it be funny if I got pulled over on this right now? Anyways, so not getting enough oxygen to the brain, or you're just getting a mismatch in signals that you're not getting enough oxygen to the brain. So then the brain, or the different autonomic mechanisms, will send a signal down to the areas that control the rate and the rhythm of the heart, and that essentially will tell the heart to speed up. If the heart speeds up too quick and you're not breathing in unison with it, you're not getting enough oxygen to saturate the blood. The heart ejection volume is going to go lower because the heart's beating so fast that it has no time to fill, and then eventually not enough oxygen gets to the brain. So it's almost like you're subtly being like choked by a very weak person. Okay, so oxygen levels start to drop, you get this little fatigue, malaise, you could get fatigue, tiredness, lightheadedness. It could also cause headache, especially when the fluctuations in blood pressure changes so gradually. So it could go low to high or high to low, and that can create changes in the tissues in the brain that will actually give you the perception of head pain. So the stuff we do with that, we try a variety of mechanisms, and like you'll see a common theme amongst all the treatment protocols that we develop, everybody's a little different. So we definitely try to cater to what we observe based on the observations while we're doing the treatment protocols. The treatments can range from anything from tilt tables, and I'm sure anybody with POTS or dysautonomia has been on a tilt table as a diagnostic test, but actually we use it in a therapeutic fashion. It's not just tilting you up and down and waiting until see where your pulse rate changes, or your heart or your blood pressure changes, but we'll also do it in a way where we find out that level where the heart rate is about to spike, we bring it back a little bit, keep it mellow, and then we do other treatment modalities, which could be anything from coordinated activities to head and neck movements, to eye movements, to even electrical stim to different regions of the face, because those have deep tie-ins to these mechanisms of autonomic functioning. So, and again, it's all about how we observe, how you perceive the treatment. What I could just say is it's worth finding somebody who's well versed in the treatment of dysautonomia and POTS, not just using certain medications to change kidney function and blood pressure and that sort of thing, but actually trying to figure out the mechanism to get the blood vessels coordinated enough where it's going to be sending the right amount of oxygen to the brain to suffice the activity that you're engaged in. Other than that, if you have any more questions, I got to get inside soon, so if you have any other questions, leave them in comments below, or give a call, 331-222-9667.